Hello, how are you today?
Hi.
Alright, well, my name is Jamie Hernandez. I'm going to be your student nurse for today. And so I'm only coming in just to ask a series of questions, and this will be based on our general survey. Is now a good time?
Yeah.
Alright, thank you. So, can you please state to me your name and date of birth, please?
Sure. Elizabeth Sanchez, 10691.
Alright, thank you. So right now I'm actually going to confirm that information right here by just checking your wristband, okay? Alright, thank you so much. And so again, like I stated before, I am going to ask a series of questions. So our first question will be, can you please state to me our current president?
Joe Biden.
Joe Biden, okay. And can you please tell me our date today?
January 13th, 2022.
Okay. And so, also, can you please tell me where you are right now at this moment?
The local clinic.
Okay. And what is your reason for coming in?
A general visit.
General visit? Okay, thank you. And so after now asking my series of questions, I can see right away that she's times 4 oriented and alert. And so right now, based on that information, I do see that her speech is clear and coherent, so everything's okay in terms of that section. I do see as she's speaking to me, she seems calm, she seems happy, so there's no distress there. And so again, I did do an overall appearance, overall physical appearance, and so I do see that there's no distress. And so for her reason for coming in, it's because of the general checkup, so there's no concern there or why she should be worried. And so again, as I'm speaking to her, I see her mood and effect, everything's fine. I see her facial expressions, it matches to the fact that she's happy. And not just that, but as I'm analyzing her from head to toe, I do see that she's dressed appropriate, not only for the weather but also for the situation that we're in. And because of the way she's dressed, and I'm also analyzing even some more, and I do see that she does have good personal hygiene. There's no neglect there, and there's no concern as well. And so because of that, I am seeing her body structure, her body build, and so everything's fine in that section. I do see how she's sitting up, and so her posture is and position is good. She has a straight back, there's no concern. And so not only that, but I do see that she's well nourished, so everything's okay. And not just well nourished, but I do see that her face is symmetric, and because her face is symmetric, I can assume that there's no early signs of stroke, or if anything, there's no outside problems that I can see. And so because of that, I do see her facial features. Again, everything's okay. And her facial features, because I'm analyzing her face and her body, I do see that her stated age does match what she told me and how she looks like. So everything's fine in that section. Now looking at her skin, I do see that the skin color is appropriate to ethnicity. And so also when she came in, I did notice her gait, and so I do see that she's able to walk fine, no need for assistive devices, and also her range of motion is pretty good. And so because of that, I do see everything's fine. And so from those columns, everything's okay now. And so can you please extend out your arms for me? Okay, thank you. And so I am going to touch you if that's okay. I'm only going to check your temperature.
No.
All right, thank you. So I can see that her temperature is the same bilaterally, and so I do see that everything's okay. As she's extending out her arms, I am noticing if there's any moles, if there's any tattoos, which I can see that she has right here, but there's no sign of infection, swelling, or redness. Everything's fine. And along with that, no wounds, everything's okay. I do see that she has a little cut here. Is everything okay there? Is there any problems?
It's my cat. It's like a small little dot.
Oh, okay.
Yeah.
All right. And so as I'm still analyzing her arms, her skin color, I do see that there's good pigmentation, a pink undertone, showing any signs of blood flow. And so I'm seeing that. I do see that, again, skin color is appropriate to ethnicity. Not just that, but now I'm going to be touching her skin. I do see that it's not too moist, not too dry. Everything's okay. In terms of the texture, smooth to touch, everything's okay. Okay, and then can you please rotate your hands? Thank you. And so now that as I'm checking her nails and her nails, I'm trying to analyze if there's any cubbing or anything like that. I do see the 160 degrees, so everything's okay. And so as I'm working my way up, I am going to check her mobility and turgor. So I'm just going to give you a little small pinch. And so I do see that there's no signs of tenting, and so she is good in terms of dehydration, or at least this is a good sign that it's not tenting at all, so that's okay. And so again, now checking, going back to her nails, I see that they're clean, they're round, good contour, and so everything's fine. Can you please rotate your hands again one more time? So I am going to check her capillary refill, seeing if it's within the 3 seconds mark. Just checking a little few other fingers, and so everything's fine, everything's okay. Again, seeing the color of her fingers, everything's fine, and the color of her nails, okay. I do notice that again she has her nails done, but again, no concern in terms of cubbing, because you can still see despite them having their nails done. And so now I'm going to actually check your head. I'm only going to check for distributions of hair and so on. So I am checking if there's any lesions, if everything's okay. So no problem here. In terms of her hair as well, I am also checking the texture, so making sure everything's okay. I'm noticing the colors, and so I do see that her hair is dyed, so everything's fine in terms of colors. And so again, I feel no bumps, I feel no lesions, see good distribution of hair, and so everything's fine. All right, well, thank you so much. Our assessment here is done. And so do you have any questions for me? No? Okay, well, I'll be right back. I'm just going to document some information to the doctor, and so I'll see you shortly.
Thank you.
All right, thank you.
Bye.
1 second. All right, have a nice day.
Bye.